Good morning. You're listening to Dental MD. This is Dr. Jessica Sapoff. And today I am talking about choices in dentistry. As a holistic dentist, the choices that I talk about are everything mainstream, because you need to understand what those choices are, and you are entitled to those choices when you have situations that arise. But from a holistic perspective, which means that I'm going to tell you what you would normally get to hear about in any ordinary mainstream dental office, but I'm going to explain those in terms of other choices that are available that you might not otherwise get to hear about. So you're definitely given options when you go into any dental office, but there are some, not just other choices available, but sometimes reasons for making certain choices shift once you have a holistic perspective on those. And the first topic that I'm going to cover today is facing the loss of a tooth. So facing the loss of a tooth is a very different experience in a mainstream office from a holistic office. And holistic always refers to considering the entire body and being in your consideration. And the mainstream perspective is usually limited, primarily and fundamentally limited to what the effect is on your mouth and teeth, and not necessarily on the surrounding structures or your systemic health. So surrounding structures can mean musculature, jaw joint, airway, other things like that, which are not always taken into consideration and don't always need to be, but generally aren't, even when they do need to be in a mainstream office. But the effect on your overall systemic health and well-being that's the main difference when you go into a holistic office or listen to a holistic perspective. So let's talk about facing the loss of teeth. It really depends partly on which tooth is being lost. If it is the last tooth in the row on the top, so way in the back, upper molar, replacing that tooth is not really a big deal. Basically, if you lose your very last molar on the top on one side or on both sides, your other teeth are not going to drift or shift because everything else is stable. If your occlusion is a standard occlusion where your upper and lower jaw relate and align together in a normal way, then loss of an upper second molar or third molar, if it's been in use, is generally not an issue when it comes to the drifting and shifting of the other teeth. And in addition to that, if you have your first molars and everything forward of that, this is assuming you have all of your other teeth still, you're really not going to notice very much change in your chewing efficiency. You may not even really miss the tooth because your tongue doesn't venture back there in that upper corner too much normally. So whether or not that tooth needs to be replaced, if lost, is very much a personal choice. Some people need symmetry. That's important to them. And so missing one on one side is a disturbance for them. And in that case, you might want to replace it. If you've lost the last tooth in the back, the only way, you don't have a tooth behind it to support a bridge, a cemented in, fixed bridge. So your only choices are either to get an implant there or to wear a partial denture. And on the top, a partial can be a little bit of a nuisance. It goes partly over the roof of your mouth. You'll notice that it's there. You'd probably notice less if you just didn't get anything. But an implant on an upper back molar is an issue because normally the sinuses are not too far from where the tooth roots were, and you might need to get some surgeries on the bone and sinus floor first before you can even get your implant up there. And a lot of people just don't want to go through a lot of surgeries and ridge augmentation and all of that for a tooth that they don't really need for chewing efficiency and don't really miss because their tongue doesn't really notice it being gone. So that's kind of the only tooth in your mouth that has that situation where you have those choices of really not replacing it if you don't want to. For all the rest of the areas, if you lose a tooth that isn't the last one in the row, or it's the lower molar last one in the row, then the upper molar that used to chew against that one will drift and shift. It'll start to drop down. It'll get in the way of your bite eventually. It'll actually continue to erupt. Even if you're an adult, it starts to erupt again because it has nothing to chew against, and so it thinks it needs to move until it comes into contact with something. So you have to get something to keep that last upper molar from drifting and shifting if you're facing the loss of the lower last molar in the row. Now, your choices for the lower are a little bit different. The lower bone is usually in, you don't worry about sinuses. Sometimes you have to worry about where the nerve is down below and use a type of an implant that won't interfere with the nerve or impinge on the nerve. But the bone itself tends to be more dense, doesn't need grafting or augmentation as often. The bone on the lower jaw just tends to be more dense and more easily accepting of, and the success rate of lower implants is better than upper implants. Now, if it's a lower molar and it's your last one in the row, usually people do feel like they want to replace that one because your tongue drops in there. Your tongue is going to notice that more than with an upper. And like I said, the upper molar that used to chew against it will start to move and drop and drift. And you'll end up with food traps between the upper two back molars, and that's no fun either. So replacing a lower second molar is going to be, something you are going to want to do, most likely. And some people don't, and the asymmetry doesn't bother them. And you can wear a night guard on the upper arch or a retainer to keep the back molar from drifting. That holds it in place. And if you just wear that at night, that stops the upper molar from drifting. So that's a simple, inexpensive solution to prevent drifting and shifting. Your chewing efficiency is probably still going to be okay, but your tongue, like I said, may drop in there and notice a lower molar missing more than it would an upper molar. So that's for second molars, upper and lower, as far as losing that tooth. But any other tooth in your mouth is either going to be between two other teeth or in the front where it shows. And so you're going to want to replace a tooth if it's in the front with something, obviously. And you have a lot of choices ranging from not terribly expensive all the way to very expensive. And removable or cemented in or permanent or with an implant, which is an artificial root that then a dentist will place a crown or the part of the tooth that you see will be cemented on or screwed into place on that implant fixture, which is the artificial root that's been put in. And usually you can't get the new tooth put on it right away. You have to wait while the bone heals and fills in. It all depends on what the situation is at the time that the implant is placed. Sometimes it's solid and can be load-bearing from the very start. Other times it cannot. It all depends on how long ago the other tooth was extracted and how the condition of the bone is, whether grafting and ridge augmentation is necessary, and all of that. And the right people to talk to about what those necessary steps are is the person who's placing the implant, which is the artificial root. So in the front, and those nice, beautiful, pointy gum tissue papilla between all of your teeth, that papilla next to the tooth that's been extracted will tend to flatten out. So if your gum tissue shows when you are smiling or talking, then you may want to consider how that delicate, pointy gum tissue between the teeth gets handled. Sometimes that can be improved aesthetically with a little periodontal or gum surgery, like a little gum cosmetic surgery. It is important because otherwise you could end up with what we call black triangles between the teeth where the base was and where the new tooth is going, the implant. Sometimes if a bridge is put in, which is it cements to the neighboring teeth, the tooth on either side of the space. Sometimes pink dye can be used in the ceramic itself to pretend to be gum tissue there. That sometimes works aesthetically. Other times, just keeping food out by shaping the ceramic in a particular way can solve the problem of food and other stuff getting under the bridge. If it's in an area that doesn't really show, or if that's enough to get rid of the black triangle look, you may not need to have a pink papilla. You just need to not have dark gaps. That would, in some cases, aesthetically, that's enough of a solution. It just depends on the situation and where your lip falls to when you're smiling and talking. So that's with front teeth. Now, the teeth on the sides may not be, if you have little black triangles or gaps between, that may not be a big deal. It can be a nuisance because food can get in there, especially if implants are used, because there does tend to be a little gap at the gum line on either side of even if the flossing is nice and snappy in between those, contacts are adequate and normal. But you still, as you get down toward the gum, there may be an air gap there, and you may get food there, which can be quite a nuisance. Sometimes it doesn't bother people, but other times it is really a nuisance. And once you've paid for all that and it's all in, you just kind of roll your eyes and deal with it. You irrigate, you use toothpicks, floss, whatever you have to every time there's something there irritating you. So that's like a common experience with implants. Bridges, it can be a problem, but like I said, the ceramic can be shaped differently if you're getting a bridge. The disadvantage of a bridge is that the neighboring, this can also be an advantage, the neighboring teeth that the bridge is going to rest on and be cemented to, it all depends on the condition of those teeth. Let's say those teeth are perfect and have never had even a small filling. Well, you don't want to cut those teeth down to create rests for the bridge. Those teeth would have to be reshaped, not drilled down to little stumps necessarily, although a lot of dentists still do it that way. They just need a dovetail shape, just enough wraparound to make an adequate support for the bridge. I do very conservative bridge preps, but I still don't like to do it on teeth that have never even had a filling before. If I'm just they're placing a filling and maybe reshaping a little bit and extending it by a few millimeters on each side for an adequate support, that's not really compromising that tooth. Essentially, you're basically replacing the filling that was already there and extending it a little bit. And I can do that on both sides. If there's a medium to large filling, then I'm really not cutting away very much more tooth structure at all and not putting those teeth at risk. But if I were to, which I don't, but if I were to cut all the way around those teeth to make crown unit supports or abutments, that would really compromise those teeth quite a bit. The more drilling you do, the more chance that the nerve inside the tooth will react, become inflamed, and sometimes not recover, resulting in a dead tooth that needs, now that it's holding up a bridge, you're not going to want to extract that one. I mean, some people would and just pitch the whole thing, but you don't want to put these teeth at risk because there are people who don't want root canals at all. And if you have a tooth die and it's holding up a bridge and you aren't opposed to root canals, then you're going to end up getting a root canal on the support tooth. And that's really a shame when that happens. And so I try very hard not to traumatize the neighboring teeth. All right, we are coming up on a break. I'm going to talk some more about bridges and design and replacement of missing teeth when we return from the break. You're listening to Dental MD. I'm Dr. Jessica Sapoff. We'll be right back after this break.
Did you know as many as 15 million Americans have been diagnosed with COPD, chronic obstructive pulmonary disease? Sadly, COPD is the third most common cause of death in the United States. Hi, I'm Representative Cindy Rhee from Washington. As many as 12 million adults may have COPD and not know it. COPD could include wheezing, cough, chest tightness, and shortness of breath, and it can vary from day to day. COPD is a disease that can worsen over time, and patients may experience flare-ups. Flare-ups can increase shortness of breath and uncontrollable coughing and may lead to hospitalization or even death. While COPD is not curable, there are treatments available to help you breathe better and prevent flare-ups. If you or a loved one has COPD, please talk with your doctor to create an action plan that fits your lifestyle. For more information, please visit womeningovernment.org.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
Going our own way every day. Alternative Talk, 1150.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. Today I'm talking about choices in dentistry. And in the first segment, I was talking about the loss of teeth and where in the mouth the tooth is that is being lost and what kinds of options and choices you have for replacing these missing teeth. So I talked about the very last molar in the row and whether it's the top or the bottom. I talked about front teeth or teeth on the sides where it shows and what kinds of choices you have. And I was talking about fixed bridges. Sometimes people think bridge means removable partial. That's a misunderstanding. There are different words that are used to describe these things. But when a dentist says bridge, we mean a fixed bridge. So it's cemented in, it is cemented to the neighboring teeth on the sides, on either side of the space. Sometimes 2 teeth are missing next to each other, and a 4-unit bridge is made so that it's an abutment, then a pontic, and then an abutment. The pontics are the the teeth in the space, the bridge. Pontic actually means bridge. And the teeth on the sides don't necessarily need to be cut down to little stumps and have the abutment units be crowns. They can be onlays, they can be inlays. Depends on where the tooth is and how much support is needed. Now, it is a shame to cut good teeth that have never been cut or just have tiny fillings in them. And in cases like that, a lot of times it does make sense to choose an implant if you don't mind having a permanent artificial root implanted in your bone, which will likely never be removed from there. And the other thing that sometimes happens with the neighboring teeth is that at the time that you need a tooth replaced, the teeth on either side of that space, for some people, those teeth already have large restorations or crowns, and frequently those large restorations and crowns are mercury fillings and or porcelain fused to metal crowns, and the metal is not a high-quality metal. It's a metal that contains nickel and other, I consider, junky types of metal. So, and nickel is highly allergenic and irritates the gum tissue in many people. So if you have those kinds of restorations in the neighboring teeth, then in the process of getting a fixed bridge, all of that objectionable metal material is removed in the process of making the bridge. At least in my office, it is completely removed. I don't leave any remnant of the old metal restorations. We remove all of that, and then we rebuild the teeth with buildups if needed, and then we go ahead and take an impression to have a solid ceramic bridge made. And now you have a 3-unit bridge or a 4-unit bridge that is completely metal-free. The teeth on either side have been relieved of their old, possibly even failing restorations, which were metal or which maybe weren't aesthetically pleasing anymore, and you wanted to get them replaced anyway someday. And so that's a good opportunity to get rid of those old restorations and do a nice bridge in that place. However, in a lot of offices, especially mainstream, they don't think those old restorations are any problem unless they're ugly, and they don't see any reason to drill out or replace old metal restorations. And so they will usually try to talk people into just getting an implant because they do the surgical procedure, they put in the artificial root, and a crown is placed on that, and they consider that to be a single tooth replacement, and it's done. And they don't see any reason to do anything to the neighboring teeth. And they may even tell you that bridges fail more often than implants and things like that to try to, the statistics, it's just like with a lot of data. A lot of times the statistics that are quoted are cherry-picked, certain studies, certain, and they may not have investigated who paid for the studies that they're quoting numbers from regarding how often restorations fail. And I'll just give you a for instance on that one. The dental profession is still saying that amalgams last longer than composites for filling material. But the way that they got those statistics that say that amalgam lasts longer is that if an amalgam in a tooth, if that tooth breaks a piece of tooth structure off and the amalgam is still sitting there in the tooth, they don't consider that an amalgam failure. They consider it a tooth failure. So they don't count that as an amalgam failure, even though we know that amalgam fillings, which are the mercury fillings, expand and contract more than your natural tooth structure does when you eat and drink hot and cold food. So the amalgams are known to expand more than your tooth structure, which means that they cause cracks in your teeth. So when a piece of your tooth breaks off, in the holistic world, we do consider that that was caused by that amalgam in many cases. But statistically speaking, because the way the profession looks at these fillings and these broken off cusps, they don't count that as an amalgam failure. They just count it as a tooth failure. And so it doesn't go into the, get added in with the number of amalgam failures. They only consider that if an amalgam cracks, across the middle of it, or chips or something like that, the filling material itself. But when they're looking at composite resin fillings, you have a tooth-colored filling next to tooth-colored tooth, and sometimes the interface between those two will get stained if the bond begins to break down at all at the surface. Even if it's very superficial, it'll get a brown stain along the edge. Even if the filling is still intact, they will consider that to be a failure of the filling. And so it starts to look like a lot more composites fail than amalgams if you count them in that way. And so when you're listening to people talk about numbers and data, it's very important to look at how the studies were done, which studies are being quoted, and who paid for these studies, and what their motives might have been. And that's a lot of research. You really shouldn't have to go and do all that research. You should be able to rely on something that a professional tells you. And I feel it's my duty to look deeper into these kinds of numbers and statistics before I quote anything to my patients, because it's my job to understand the research and the studies when I tell you when I'm advising you on which kinds of restorations or tooth replacements are best in your particular case, based on where it is in your mouth, what's happened with your other teeth and restorations. There are a lot of factors. So, replacing teeth really depends on where in your mouth and what kinds of things are in the neighboring teeth, what kinds of old restorations or not, whether it's a tooth that shows, whether it's on the top or the bottom. And implants are not always the best option. And frequently, people who are holistic really don't like the idea of having some foreign material, which, by the way, implants are generally sprayed with a fluoride coating to get the bone to grow in around them more effectively. And so some people don't like that idea either. But that's just a personal philosophy preference, which needs to be uncovered and honored for patients. They need to be given the options. You need to be given the options and told everything about all those options so you can really make a choice that's right for you. All right, you're listening to Dental MD. I'm Dr. Jessica Sapoff. If you have questions about any of the things that I'm talking about on this show, give us a call, 425-427-8899, or reach the front desk by email, appointments@naturaldentist.com. I'll be right back after this break.
I'm Dr. Anthony Lazarowitz, and this is Climate Connections. It's been 13 years since Hurricane Katrina hit New Orleans, and the effects are still felt every day.
We still don't have no grocery stores. We still don't have no department stores or food chain stores. We don't have nothing that we had before Katrina. Everything was destroyed.
Reverend Richard Bell lives in New Orleans' lower Ninth Ward. During Katrina, floodwaters breached the city's levees, inundating Bell's neighborhood. Some areas sat in 12 feet of water for 6 weeks. Bell was able to rebuild his house, but he says there are areas of the lower Ninth Ward that still look like a wasteland.
You got a lot of empty lots with tall grass growing where you can't even look beyond the stop sign. We still hadn't got past Katrina. We have a long way to go.
Climate change is making extreme weather more common. And though the news coverage about any particular storm largely disappears after a few weeks or months, people's lives are often affected for years to come.
Life will never be the same no more.
Climate Connections is produced by the Yale Center for Environmental Communication. Learn more at yaleclimateconnections.org.
Time is funny. Sometimes it seems fast and other times slow. When it comes to time slots remaining on Alternative Talk 1150, time is running out. In fact, there are just a few primetime slots available. So if you want to host your own radio program, the time to call 425-653-1150 is right now. Nope, no time for excuses. Dial 425-653-1150 to find out how affordable it can be to host a radio show. Alternative Talk, we have an opportunity waiting just for you.
Alternative Talk 1150. It's good for what ails you. This statement has not been evaluated by the FDA.
Welcome back. You're listening to Dental MD. I'm Dr. Jessica Sapoff. And today I'm talking about choices in dentistry, and I'm covering the loss of teeth and what your choices are depending on what other restorations you might have and where in your mouth the tooth in question is located. If it's in the front where it shows, if it's on the side with other teeth that might drift or shift into or toward that space and start leaning over or dropping down. The drifting and shifting is very, very slow. It happens slowly. Sometimes people go without a tooth for a while, and it happens so slowly that the other teeth start leaning and turning and drifting, and you may not notice it, but by the time you decide, yeah, something is happening, you're getting more food caught, or it's getting harder to clean something, or maybe your jaw has started to click, or a tooth breaks because it's no longer hitting the same way when you bite and chew. Now you're thinking, I guess I better do something about this. Well, if there's been a lot of tilting and drifting and shifting going on, then it may not be so simple. It's simple while the teeth are still in their original positions, unless they were out of position to begin with. But once the teeth have drifted, shifted, tilted, rotated, dropped, all the different things that they do over time when you've lost a tooth in between, one of the things that can be done, sometimes it's the drifting and tilting is not too bad, but if they do an implant in that spot and you have a tooth behind the implant that has tilted, then you will probably end up with a big food trap. And sometimes it's a good idea to do what's called uprighting of the teeth. So you do a little bit of orthodontic treatment and you reposition the teeth. And yes, this can be done in adults. It's not a problem. Molars can be uprighted. It's done all the time. And the tooth in question, maybe the upper teeth have drooped and the back molar has tipped in toward the space. All of that can be corrected. Everything can be realigned and straightened back out. Now you have a nice vertical space where that tooth is missing, and the neighboring teeth are aligned with that and facing the right way again. Now, when you get an implant or a bridge, you are not going to have excessively large food traps all around it. And the teeth are also biting and chewing correctly again, so they're less at risk for breakage just during normal use. Teeth that are tipped and aren't hitting squarely anymore with the tooth that opposes them, those teeth are at risk for breakage. You're at risk for periodontal problems because of food traps and also because of the angle of forces on the teeth, which can cause bone loss down below. There are a lot of problems with tilting and shifting and drifting and all of that, more than you could possibly realize. And these problems are not always easy to fix. But one of the ways that we can fix at least part of it, sometimes all of it, is by using orthodontics to reposition the teeth before preparing the area for a bridge or an implant. Now, your other option besides bridges and implants, which are the permanent choices for tooth replacement, where they're either drilled into the bone or cemented onto the neighboring teeth, your third option is a removable partial denture. Now, it's no worse really than wearing glasses. You have a thing you need in order to chew, in order for your bite to be stable. It helps keep your other teeth from drifting, and they look nice. If they're made nicely, then it really can look exactly like a tooth and like gum tissue if you are missing some gum tissue as well, aesthetically speaking. You need those pointy pink tissue peaks in the front, depending on whether your gum tissue shows when you smile and talk. That makes a very big difference aesthetically. It's not just the teeth, it's also the gums are part of your beautiful smile. So your other option, if you either don't have the money or you don't have the money yet and you need to save up, you might want to get a removable tooth or teeth to wear. Nobody will know you have that except you. If it's made nicely and it looks nice, some people find that they love having a removable tooth. They can take it out, clean it. You know, if it's made well, it'll look nice and you won't get food caught around it. Eventually, as your body changes and the tissues change a little bit, you might start to get a little bit of food around it. Then it's probably time to just get a new impression and have a new one made, or maybe reline it or do some other procedures with the partial to make it fit perfectly again. There are lots and lots of options and choices with partial dentures. And one partial can have numerous teeth on it. And it really depends, you know, if you're losing a tooth, but you are already missing a couple of other teeth and you can't afford 3 bridges or, you know, 3 implants, or there's some other reason not to do those procedures, then, you know, a partial denture, if it's made nicely, and the ones we have made don't have any metal in them, it's just a very, very thin vinyl or plastic or acrylic, and a nice biocompatible type of material that just it just clicks onto your other teeth. It just snaps in and stays put, and they look nice. Nobody knows it's there but you, and they are much more economical, actually. They're not cheap, but relatively speaking, if you get one partial and it's, you know, got a couple or 3 teeth on it, that is significantly less expensive than 3 bridges or 3 implants. And sometimes you'll use that while your implants are healing so that you have teeth and the rest of your teeth don't drift or shift and it looks nice. And you might use that for up to a year while your implants are healing, or while you've got, you know, sinus and bone augmentation surgeries to prepare the area for the implant. Getting implants in some cases can take many months or even up to a year to heal in, prepare the area surgically, and then get the implant, and then it heal. I mean, it all depends on the situation. Not everybody can get their implant in and get the tooth put on it immediately. That's kind of a rare situation unless you're doing multiple implants at once. And if that's the case, then even if 1 or 2 of them can't be load-bearing, the ones that are load-bearing, because they were able to go enough into solid existing bone that they're stable while the rest of the bone heals, then they might be able to place something on all of them at once because it's supported well enough by 2 or 3 of the implants. That's what you see on TV when they talk about the immediate teeth, where they do the implants and put on some kind of temporary thing that day. But that is not the typical case for implants. But, people will wear a little partial or even a temporary partial, which is sometimes called a flipper because the temporary partials have a reputation for being loose, and so people flip them or can flip them out with their tongue. But that is, if they're made well and they fit well and they look nice, that can be an excellent solution for missing teeth, front or back. It also puts something there so that the other teeth don't drift or shift, so that someday if you want to get an implant or a bridge, all the teeth will still be in their original upright and proper positions, which is good. Now, I do believe that we're going to have the technology before too long for regrowing teeth. They already can do it, and I don't mean regrowing a part of a tooth that has decayed away. That's a separate topic, but there's some confusion about remineralization of existing teeth that have had decay. And teeth can remineralize, but if there's already a hole or a broken off area, that will not regrow. You cannot regenerate that part of that tooth or fill back in that hole by remineralizing. That's not how it works. You can just remineralize the surface, and if the surface has a big hole in it, that hole will remain and should be restored. But where was I going with that? The remineralization, regrowing of teeth. The regrowing of teeth is where they actually put in a tooth bud and then energize that, and within weeks or months, you actually, in the research, they have been able to regrow teeth, whole teeth, and have it erupt into the mouth and be the right tooth in the right place, facing the right direction, totally new regrown tooth. Now, that is something, if you don't have enough bone there, or if you've already had an implant placed, I don't know what the procedures are going to be to make it possible to regrow a tooth in that instance, but they can already do it in the research. They've been researching this for more than 10 years. It just has not been made available to us general practitioners or practitioners of dentistry to make available to the public. It's not available yet, but I think it is going to be available. So that is something, if you want to look into that and you feel positive that that's new technology that's going to be available, and I do feel that it is going to be available before too long, then you may want to consider that in the future and not do certain things that might preclude that as a choice for you later. All right, you are listening to Dental MD. I'm Dr. Jessica Sapoff. If you have questions about any of the things that I am talking about in this show, give us a call, 425-427-8899, or you can reach the front desk by email, appointments@naturaldentist.com. And I will be right back after this break.
So how long has it been since you've been to the dentist? Yeah, I'm talking to you. I know going to the dentist can be tough, but did you know that healthy teeth lead to a healthy body? I know what you're thinking. All dentists are alike. They lure you in for the free exam or, complimentary cleaning. And before you know it, wham! Huge dental bill. And did you even need all that work? Well, why not try a different approach? Natural Dental Health Associates in Issaquah specializes in taking care of you. Their easy, no gimmick, honest approach to dentistry will have you forgetting you're actually in a dentist's office. And the best thing is, they're all natural. Yep, no mercury, nickel, or other harmful chemicals are used. Click on your media player now and get started on the road to better dental health today. Or call 425-427-8899. Natural Dental Health Associates is a proud sponsor of the Dental MD radio show, Wednesdays at 9 a.m. on Alternative Talk, 1150 a.m.
1 in 3 adults has prediabetes. 1 in 3. That means it could be you, your football buddy, your football buddy, or you, your best man. your worst man. You, your dog walker. Your cat jogger. While 1 in 3 adults has prediabetes, with early diagnosis, prediabetes can be reversed. Take the risk test at doihaveprediabetes.org. That's doihaveprediabetes.org.
Wait, did they just say 1 in 3 adults has prediabetes? That's 33.33333% of adults. That means it could be me, my boss, or my boss's boss, or me, my favorite sister, or my other sister. That's 7 members of my 21-person romantic book club. Wait, the 1 in 3 could be me, my karaoke partner Carol, or my karaoke enemy Jeff. I'm gonna take the risk test at doihaveprediabetes.org.
Brought to you by the Ad Council and its Prediabetes Awareness Partners.
Make it a great day. Keep your dial on Alternative Talk 1150.
Well, you're listening to Dental MD. Welcome back. I'm Dr. Jessica Sapoff, and today I'm talking about choices in dentistry, and I'm covering the loss of teeth, not the impending loss, but it's already definite. You're going to have a tooth extracted, or the tooth is recently extracted and already missing. And I've been talking about bridges and implants and partials and partial dentures, removable partial dentures, RPDs. And I also talked about regrowing teeth, which is not available yet, but has been in research and has been successful in research for 10 years, at least. So I'm very hopeful. I think we're going to have that technology before too long, and no predictions, though, because we just have no idea when they're going to release that so that we dentists can make that available to the public. Now, in this final segment, I am going to talk about missing teeth in children. When children lose teeth early, not the usual, normal tooth loss where it gets loose and falls out because a permanent tooth is coming in underneath it, but when there's been a lot of decay or the pulp has died and the parents want the tooth removed, or the parents might want a baby root canal and a stainless steel crown, but after that's done, the tooth still fails sometimes, and so it needs to be removed. Now, it depends on the age of the child, whether they have their 6-year molars in yet, which come in behind the last primary tooth, and what age the child is. How close is the permanent tooth to coming in? Is it going to be in a few months, or is it going to be years before that permanent tooth comes into that space where the tooth is being lost? Is it a back tooth or a front tooth? So let's talk about these different issues, because for children, the solutions are different and the situation is different. Let's say a child is missing or going to be missing a front tooth, and they are between the age of 2 and 6. After age 6, those teeth are getting loose and coming out, and the permanent teeth are getting ready to come in, as long as they're not missing the permanent tooth. And so you don't do anything at that point after age 6 or so. But for the 2 to 6-year-olds, if it's a front tooth, you don't have to do anything. The other teeth will not drift or shift. It's not like adult teeth. For kids in the front teeth, generally it is considered perfectly acceptable to leave the front teeth missing and not replace them. Children cannot wear a partial denture. They cannot have a bridge across that area. They're still growing. And obviously you're not going to do implants because you've got permanent teeth down below in the bone, so you're not going to put in artificial roots. Children also, some kids, if they're 2 to 4, that's an early loss of a front tooth. They don't look like their friends anymore because their friends still have those teeth, and nobody that age is having teeth get loose and fall out naturally. So, you kind of have to just deal with the aesthetics. Generally, children that age really don't care, and that's good. By the time they're 5 or 6, they might care, but the new teeth are going to be coming in pretty soon. By age, 6, 7, those front teeth or permanent teeth start to erupt. So they really just have to sort of wait it out and wait for those permanent teeth. You can't put in any kind of spacer across there, and you don't need to because the other teeth don't drift. But you can't put in any kind of retainer or partial denture because if you did, it would restrict growth. It would stop the arch from being able to grow and expand as those permanent teeth develop underneath. And so you don't want to put anything restrictive in there. For adults, you can because their adults are no longer growing, and so you can put in something permanent across there, the missing area, teeth where teeth are missing. Now, if it is a back tooth on a child or the cuspid you can leave. You don't have to worry about replacing that, but the premolars are supposed to come in underneath the primary molars, which if those are lost early, you have to put in some kind of space maintenance because otherwise the teeth behind the lost tooth will just drift forward very easily and pretty much close up that space. The teeth naturally come in and grow forward, and if the child is losing a primary molar, that has to be, if they're not age 11, 12, or 13 when this molar is lost, then you have to put in some kind of space maintenance or else back teeth will just grow forward into the space, and that will block out the permanent teeth that are supposed to come into those spaces, those places. And there are a lot of different ways to do space maintenance. Let's say, for instance, the child has crowding and narrow arches and you want to do some expansion orthodontics. Anyway, those orthodontic appliances will act as your space maintainer. They will recreate space if space has been lost. They will expand and shape arches to prepare the teeth or to hopefully eliminate the need for further ortho in the future when the permanent teeth are all in. Sometimes the best you can do is create space and make ortho later easier and quicker, which is also good because the expanding the closer you can get those permanent teeth to come into their right places, the less relapse you'll have later. So as much as you can get done to shape the arches and expand the arches to make room for the permanent teeth, the better. The earlier you do it, the better. Starting around age 5, 6, 7, 8 is like the best window for expansion and arch shaping. And at the same time, you're holding the space where the tooth was lost until that permanent tooth can erupt. And that eruption of the bicuspids, or premolars, they're sometimes called, that usually happens between earliest maybe around 9, 10 years of age, but can be as late as 13 or 14 years of age. But generally the average is 11 or 12. So you're going to need some kind of space maintenance until those teeth show up in the arch, start to erupt. And at that point, you should be pretty much nearly finished with all of the expanding and arch shaping that can be done with what's considered interceptive orthodontics. Interceptive means we're coming in with our orthodontic appliances while the child is still growing, rather than waiting for them to finish growing and have all of their permanent teeth in, crowded and jumbled, and then starting the ortho. That's how it was traditionally done, and that's why a lot of times extracting teeth was recommended, because everything would come in and be very crowded. But I believe that if you start young and expand and shape the arches and make room for these permanent teeth, then there really would not need to be so much extraction of teeth for orthodontic treatment. These days, I think fewer orthodontists are extracting teeth to do ortho, but it is definitely still done. So that's the story for children and missing teeth for children. Sometimes they will lose a second primary molar and they're not 6 years old yet and the 6-year molar hasn't come in yet. That is very tricky. As soon as that molar appears, it has to be grabbed and put back into position. So anyway, today we have talked about choices in dentistry and the loss of teeth and replacing missing teeth in different areas of the mouth for adults and children. If you have questions about any of the topics that I've talked about today or on this show in the past, you can give us a call, 425-427-8899, or you can reach the front desk, appointments@naturaldentist.com. This is Dental MD. I'm Dr. Jessica Sapoff. Thank you for listening.
Dreams that you dream of once in a lullaby.
The views expressed on this program are those of the host, guest,